Welcome, everybody. It's so good to see so many faces showing up. I know that Zoom fatigue is real, so we appreciate you all showing up here for our Bay Area Lyme Speaker Series. We will be taking questions in the chat as we can. My name is Lia Gaertner, and I am the Director of Education and Outreach at the Bay Area Lyme Foundation. And I'm going to start sharing my screen. Please have patience with us. We're doing this by ourselves here with no tech support. So here we go. So this is the Alternative Treatments for Tick-borne Diseases Speaker Series, sponsored by the Bay Area Lyme Foundation. The Bay Area Lyme Foundation is the largest nonprofit funder of Lyme disease and tick-borne disease research in the US. Every dollar that gets donated goes directly out to research because we have a grant that covers our overhead. So we've awarded over, what's that? We've awarded over 100 project grants at 37 institutions, and we've tested 21,000 ticks from 49 states with our citizen science project. And our publications have been quite numerous from that study. We've reached more than 2 million people with our outdoor prevention, tick-borne disease prevention program. And we have really proud of our Lyme disease biobank, which has really moved a lot of Lyme disease and tick-borne disease research forward. We funded more than, well, now 17 million in novel research for the prevention, diagnosis, and treatment of Lyme disease. We have also sponsored so far 7 influential Lyme conferences at places like Stanford and Harvard. And we have hosted 21, now probably 22 speaker series events all the way from California to New York. As I mentioned before, our citizen science study was recently, the latest article to come out from that study made it into Smithsonian and the Washington Post, showing that it's never been studied that there are ticks in the vegetation and chaparral and grasses by the beaches. That's just an example of something that our foundation does on this, on the ecology side. So I've been asked to talk about myself today, not to talk about our foundation or to give the basics of Lyme disease. That's another talk. That's a talk that I give all the time as the Director of Education and Outreach at the Bay Area Lyme Foundation. I'm honored I get to speak to service people, park rangers, children, educators, medical providers, the public. And that's not what this talk is today. Today is supposed to be a talk from a Lyme patient, which I am as well. I do have fun working at the Bay Area Lyme Foundation. I love my job. I get to hang out with people like Jay Leno and superstar behind me in this picture, Kristen Honey, who's working at the HHS in the US government at one of our fundraisers. So how did I get here? Why do I work for the Bay Area Lyme Foundation? What's my Lyme story? Well, a tick recruited me for this job. This is a picture of a teeny tiny microscopic tick under our daughter's microscope. I found a little inflamed red area on my thigh, and my husband, even with a magnifying glass, could not tell what it was. So we put it under a microscope, and there was this tick. It hadn't been on very long, and we tested it, and I was tested, and this is not the tick that gave me Lyme disease, but this is how small they can be. So that's the short answer. A tick recruited me. Actually, 2 different ticks recruited me to this job. My personal story, I was born in the Bay Area of immigrant parents, and I grew up in Oakland. And I didn't have a lot of nature exposure, but I was lucky I got to go to summer camp a few summers and really developed a love of nature. So I started teaching myself, learning to backpack and enjoy the outdoors. So when I went to UC Berkeley for college, I worked outside as much as I could doing field work. This is me in Poland, northern Poland, doing limnological research, counting mosquito larvae from lakes. And then in my last year of studying environmental science and agroecology at UC Berkeley, I was fortunate enough to be able to participate in a class called Biology and Geomorphology of Tropical Islands, which is pretty amazing that the UC Berkeley campus actually has this little substation in Polynesia. So because I was, I think, the only person in my cohort to speak French, and it was a French-speaking country, I became friends with the locals, and they invited me to do things like go boating, eat with people, and it was really fun. So on one of these boats, at one point, I fell out close to the shore, and I cut my foot on a piece of coral, and it was a pretty serious gouge. And so my friends there took me to a little Tahitian lime tree that was growing by the shore, and cut it open and squeezed it onto my cut. And they said that it would help keep the infection at bay that might come from live coral and other things that might be living inside my wound. So that was my first exposure to really on-hand plant medicine, the power of medicinal plants. So I quickly changed my project, my semester-long study project, from invasive snail species to interviewing my friends' grandparents and the various healers on the island. And I started collecting plants and preserving them, medicinal plants, for the UC Berkeley Jepson Herbarium. And I did quite an extensive study on the medicinal plants of the island, how they grew, what they were used for. It was really fun. And these are some of the plant medicines that were used on the island, being brewed in old Gallo wine jugs. Powerful, powerful medicines. And this was a traditional medicinal plant garden on the island. So I ended up publishing a paper on traditional medicine in French Polynesia. And then I simultaneously met Dr. Schweig, who was the next speaker. Then I took some time and I worked on a farm. I got to know plants more. I went to grad school, and I was thinking about going to Yale. I was accepted to Yale, and I remember thinking, oh, there's Lyme in Connecticut, and I'm going to be outdoors a lot. I don't think I want to go to Yale. So that year in 1997, the Utne Reader named Ithaca America's Most Enlightened Town, and Cornell is in Ithaca. And I thought, well, that sounds good. So I'll go there for grad school. What I did not know is that in 1997 and for many years after, New York State accounted for 35% of all Lyme disease cases in the USA, one state, and I was in the middle of it. So I did a lot of field work. I was teaching dendrology and forest ecology, botany at Cornell. I was in the field a lot. I also recreated there, had a lot of fun. Ithaca is gorgeous, as they say, because there are all of these gorges there. It was my first time being on the East Coast and seeing fall colors, so I did a lot of recreating. Meanwhile, Sunjya had taken a year to go work on a mobile surgical unit in Ecuador, where this truck was a fully operational operating room, and it would go to rural areas and perform much needed surgeries and medical care. So I went down to visit him in the summer, and we rode on top of this cargo train, and we went into this tunnel. I just found all these pictures while I was looking for this presentation. We walked in grasses, not knowing that we should not walk in grasses because there are ticks with tick-borne diseases, even in Ecuador and Europe and the Middle East and Africa. But there's a little note on the back of this photo that my friend wrote. Maybe we should have stayed on the trail. That was a little prophetic back then, but we did not at that point really understand about ticks fully. This is us laying in the grass. I put in all these, for those of you who have dealt with Lyme disease and know that ticks live in the grasses and leaf litter, I just can't believe that we did this. So I also got a grant to study alternative medicine and ethnobotany and medicinal plants in Ecuador. So this is this really neat place that was a traditional medicine place in terms of, you know, they did Quechua village sort of medicine, but they also did sort of Western medicine. So they were able to bring in the local, more traditional people and also expose them to some of the powers of mainstream conventional Western medicine. This is a midwife who does a lot of healing with guinea pigs. They actually use guinea pigs as diagnostics. And it's a really interesting, fascinating.
Why is the camera not on?
So there are, there's so much wisdom in these cultures and these plants. As most of you probably know already, most of our pharmaceuticals that we use today in Western medicine are derived from medicinal plants. So these healers have a lot of traditional information on the power of plants, and I don't know what got cut off, but as many of you know, today's pharmacopoeia, today's pharmaceutical medicines, many of those medicines and those compounds are derived from medicinal plants. And in this country, we don't all tend to have the same knowledge of the power of the plants, but there are certainly some people who really understand it. And in these countries, it was really fun to learn from these people. In these countries where we visited and did ethnobotanical fieldwork, even the children know which plants can help them with mosquito bites and if their stomach hurts, things like that. So I ended up publishing a thesis based on medicinal plants, and this is us in those ticky upstate New York woods. Sunjya came up, and this is horrible. You can see Sunjya's buried in leaves. I mean, in this day and age, now that we know about ticks and their tendency to reproduce in the leaves, we would never do this, but we just did not understand how small ticks can be and how you don't necessarily see them and how you don't necessarily get a bullseye rash. We missed all of that information back then.
Yeah, I find that picture pretty terrifying now that we know what we know. We blissful ignorance back then.
Yeah. So shocking as it may be, after all of that exposure in the most Lyme endemic area of the United States, I ended up at the Cornell Health Center with cardiac issues. I'd been healthy my whole life. I had never gone in for medical care aside from wellness visits. And so this was all very sudden for me. And I was diagnosed with different cardiac issues. And looking back, I think this was a result of a tick-borne infection and a Lyme carditis. So all the cardiologists missed the possible Lyme and Babesia tick-borne disease diagnosis. I went on for 10 years to see different cardiologists, and nobody ever did any sort of blood work on me. We went on and had kids, and Sunjya graduated from UC Irvine Medical School and went to UCSF residency in Santa Rosa. And I was being followed by cardiologists for these problems that no one understood, but I was doing okay. Pregnancy was hard, and I didn't feel great, but I was managing. I'm a pretty tough athletic person, so somehow I just managed. And then we went camping in 2008. So this is 10 years after my first report to the Cornell Health Center with cardiac issues. We went camping in Mendocino, and these are pictures from that weekend. And a little bit later, I realized I had a rash on my chest, and I took a picture of it. I didn't know what it was. This is not my picture. I can't find it, but this is from a website. But it looked like this. Most Lyme rashes are not bullseye rashes. Most are sort of solid and oval. And so my rash sort of fit that description. But because it was not a bullseye, I just didn't know what it was. I didn't realize that I'd been bit by a teeny tick while I was camping in Mendocino in the leaf litter. But Sunjya happened to be also, like me, always interested in integrative medicine, and had finished his residency and was studying, shadowing with a former resident who's older than him, who'd already gone on and was working in an integrative medical clinic. And so Sunjya came home that day after seeing a bunch of late-stage Lyme and other tick-borne disease patients, and he said, "Oh my gosh, I think I know what's been happening with you since that camping trip in Mendocino. you can't move your neck, you've got sort of meningeal swelling, and you've got hyperesthesias and neurological issues and swollen lymph nodes and migrating joint pain and night sweats and fevers and malaise and all of these things. He said, I think I know what it is. And I was like, oh, it's just, I've been going to the gym and I bought a new pillow for $120 thinking maybe it would help me be able to move my neck and things like that. So he said, no, I think we should talk about getting you evaluated for Lyme disease and tick-borne infections. And that night we were having a reunion with our friends. They were flying in from all over the country, our Cornell friends. And I told them that I might have Lyme disease. And they told me that actually it was quite common amongst our friends, but people hadn't been talking about it because they were afraid of the stigma of being diagnosed with Lyme disease as professionals and professors. But that a few of us came out of that time with Lyme disease. These are some of my lab results. When I did finally go and get evaluated, my lab results were kind of alarming in different places. And so I started treatment, and I felt worse than I had ever felt while I wasn't being treated. It was a good solid year of really hard Herxheimer reactions, which I'm sure many of you know of. When the spirochetes, the bacteria die off, things can get worse before they get better. So I had a journal, a sort of health and wellness and illness journal. And I'll just read you something. Wednesday, major word switching, which is a common thing with Babesia, which is another tick-borne infection that sometimes comes along with or separate from Lyme disease. I told my kid, at 8 at night, get your bathing suit on. And I knew I meant pajamas, but the word bathing suit came out of my mouth. And then, Sunjya, please put on a new picnic blanket. And I meant pillowcase. And then I said, I hear the mistake after I say it, but it just flies out of my mouth. Words that are not even on my mind at all. It's like being possessed. It's weird and it's scary. And then I said, Thursday, Thanksgiving, bicillin shots. Those are antibiotic shots. And these are just some of my symptoms: shoulder pain, nausea, neck and night sweats, all kinds of achy joints, heart palpitations, loss of appetite, so many things. This is just some of my medicines, bicillin shots, doxycycline, quite a journey over time. These are some of the supplements. I just found this old write-up. Some of the supplements I was on some herbal medications and homeopathic medications and full-on hardcore pharmaceutical, anti-malarial, antibiotic, anti-parasite, a lot of probiotics, industrial strength, steroids, hormones. I did it all. I really took a full approach to trying to get my body back together. It was really, truly an integrative medicine journey. I also went gluten-free, alcohol-free, coffee-free, which was easy for me because those things didn't feel good. So that was easy. I did acupuncture, and I did a lot of saunaing to detox to try to get rid of some of those chemicals and, debris from my body, lymphatic massage and meditation, mindfulness. I tried to exercise as much as I possibly could without, overdoing it. At that time, I was also doing a degree in holistic nutrition, kind of nutrition consulting. And so before I went to the next stage at that point of treatment, I wanted to just take a break. And I wanted to go and do a green juice cleanse and drink wheatgrass and try something at this little random place called the Optimum Health Institute in San Diego. I did a week of all of this really intensive body care and lymphatic drainage. And I came back, got on the plane, and I was just hungry. I didn't feel a lot better. I just wanted to eat my power bar for the first time in a week and, just really go home and eat. And so I did for the next few days. And then about 2 weeks later, my lymph nodes just drained, and all of a sudden they weren't so big, and things started to feel better. And that was sort of the end of my treatment. I think that my body had, I had cleared out the infections as much as possible, and I just needed to sort of detox my body from all of the treatments and infections. And I then went on and did my first half marathon ever. I did my first Tough Mudder, which is a sort of military style race with you know, a lot of obstacles. That's pretty hard. And that's my story. That's how I ended up at the Bay Area Lyme Foundation, because I really want to prevent anyone else from having to go through what I went through. I think if people know about tick-borne diseases and they know how to, you know, avoid tick bites or take care of tick bites and treat tick bites, people will be so much more empowered to protect themselves. So I'm going to introduce my husband, Dr. Sunjya Schweig. He's the founder and president of the California Center for Functional Medicine here in California, obviously. He is board certified in family medicine. He's board certified in integrative medicine. He did his medical school at UC Irvine. He did his residency at UCSF Santa Rosa, and he's an associate professor at Thoreau University. And I'm going to stop sharing my screen, and we'll be available for question and answer at the end of this talk. And if you have any other questions, please feel free to go to bayarealyme.org. We have a lot of resources and tips and tools there. Thank you so much.
Thanks, Leah. Wow, what a blast from the past. That was a lot of memories, a lot of water under the bridge, just recalling this journey and what we've been through, what you've been through, and what a lot of the folks on the call tonight have been through. And yeah, a lot of empathy for us and a lot of empathy for you guys, and you know, hoping that you continue on your path and continue improving. Leah, before I start, if you're not already muted on your audio, do you mind doing that so we just decrease any echo chance? Perfect, thank you. So the Bay Area Lyme Foundation is, you know, where Leah spends her day, and I've been really honored to work with them and participate on the scientific advisory board. And I just distinctly remember when we first found out about the Bay Area Lyme Foundation, how inspiring it felt, and how, you know, because for so many years, as so many of you have experienced, you know, we were in this journey as patient and family, and also myself as a provider. You know, I had to go down the rabbit hole pretty deep, pretty fast to figure out what was happening with Leah. And once I started doing that, people learned that I was willing to do this work and willing to see patients, you know, they really just started coming pretty quickly. And, you know, so it's been an honor to help them and to work with them. And I'm naturally someone who believes people and trusts people and understands that even though we might not have the tests or the, you know, diagnostics or all the right treatments, that I think it's real. And, and, you know, like you as patients and then also myself as a doctor experienced the medical system really pushing back. And so that was really hard and scary at times. But it was really inspiring to find out about the Bay Area Lyme Foundation and start working with them and participating. And so really appreciate all the work that Bay Area Lyme has done to really change the discussion and change the, you know, the research background, the scientific background to provide more answers and more options for folks. So I'm going to start my screen share. One sec. Leah, can you confirm if you see my slides full screen? Perfect, thanks. One sec. Okay, that's fine. Okay, so I'm going to talk about integrative and botanical medicine management of tick-borne infections tonight. We're going to talk a little bit about some of the background of Lyme disease and co-infections, and we'll dive into an overview of functional medicine approach. Thanks so much to, you know, I see a lot of friendly faces on the line tonight, and a lot of you know how we work and what we do. But, you know, it might be nice to hear an overview as well for you who are patients as well as the general group. And then I'm going to move into a research update on some botanical medicine studies that I've been really excited and honored to participate with and to be co-author on over the last 1.5 to 2 years. And a lot of the major funding for these studies came from the Bay Area Lyme Foundation. So again, deep appreciation. And then we'll have time for some question and answer as well at the end. So this is an Ixodes tick that we found on a hike in Santa Fe, out near where we live. And the ticks that transmit this kind of tick transmits Lyme bacteria, and it's all over California and really all over the nation, all over the world. But the public health department doing tick drags has shown the presence of these ticks in 56 out of 58 of the counties here in California. And they've actually shown the Borrelia bacteria inside of those ticks in about 46 out of 58 of our counties. So anyone who tells you that there's no Lyme in California, respectfully remind them that yes, in fact, that there is, and we need to be aware of it and careful. And got it. Yeah, so in general, if you notice your mic's on, it should come in unmuted when you join the meeting, but if you do notice your mic's on, just please mute it. Thanks. And so it's important to understand that, tick-borne diagnosis and treatment is complicated, and there's many different infections or bugs that are involved. And many, if not most, body systems can be involved as well. And direct treatment of the bugs is critical and it's necessary. And many of us know about the antibiotic options, but there's many different options, of which herbs are some, and lifestyle functional medicine. So we'll go through some of those. From a single tick bite, we can contract many different infections, such as Borrelia burgdorferi, which is the spirochete bacteria that causes Lyme disease. And what we know about Lyme is it started as a cluster of juvenile arthritis-like cases that was investigated in around 1975, mid-70s, in the city of Lyme, Connecticut, which is where it got its name eventually. And it was brought to the attention of the medical system by a frustrated, scared, angry, upset mom who was seeing all of the members in her family and many in her community struggling with similar health issues that include joint pain and arthritis and neurological symptoms and rashes and fatigue. And she wasn't getting answers. She was, just kind of being blown off and told, we don't know, it's, probably just rheumatoid arthritis type situation. And later, fast forward to 1981, 1983, Dr. Willy Burgdorfer found that the spirochete bacteria was responsible. And so it's actually named after him. And so it's called Borrelia for the spirochete family bacteria that is in Borrelia burgdorferi in 1983. And spirochete bacteria are an extremely complex, elegant, very ancient group of bacteria that have long been known to cause multi-stage, multi-body system health issues. And syphilis is one of medicine's most comprehensively known spirochete bacteria. And it's well recognized that syphilis can cause many different stages of illness, same as Lyme disease, with increasing severity and more neurological complications as time goes on. And because any and all organs and body systems can be involved, it was said that she or he who knows syphilis knows all of medicine. Importantly, the Borrelia burgdorferi spirochete that causes Lyme disease is significantly more genetically complex even than its cousin syphilis. Many different symptoms are possible, as we can see here. Joint pain, swollen glands. Lia went through a lot of these: muscle pain, twitches, cramps, concentration, focus, forgetfulness. Again, any different body system. And here's a common symptom questionnaire that we use for screening patients and tracking. But this person has a score of 147 out of a total of 284. So just so many different things going on, as many of you understand personally. Here's another way of looking at the complex symptomology experienced by a patient. We see sore throats and swollen throat and low energy, full body fatigue, digestive issues, hard to move the fingers and wrists in the morning, numbness along the right arm and right leg, brain disruption, anger, brain fog, cognitive impairment. One of my patients is on the call tonight who I spoke with actually this morning, and he does an amazing job just tracking symptoms and tracking treatments, and these visualizations can really help us to figure out what's happening and how things are or are not progressing. So in addition to the Lyme spirochete, there's a lot of different other bacteria and parasites, and some of the most common co-infections then include Bartonella and Babesia and Ehrlichia species, and each of these can have their own specific symptom pictures that they can cause. We can also see Mycoplasma and Chlamydia pneumoniae as pre-existing infections that then can come join the party, quote unquote. They're happy once the immune system gets distracted and the inflammation in the body goes up. They're happy to come out of their hiding places where they might have been dormant and cause more trouble, more symptoms, and more illness. In addition, patients struggle with opportunistic infections such as Candida, fungal and mold organisms, and as well as viruses. So reactivation of viruses can be very common. Herpes viruses, HHV6 has been studied and around a link to chronic fatigue. That was a lot of the work of Jose Montoya when he was at Stanford. Epstein-Barr, the virus that can cause mono, can also be latent in the body. These viruses don't go away. They just kind of hang out in the background. And the question is always, when do these move from being a passenger to being more of a driver of your symptoms? And so we're always trying to tease that apart. So as many of you know, again, the treatment of tick-borne diseases is really complicated and can take a long time. And every body system needs to be addressed and balanced, restored. I kind of like this analogy of a symphony where you have to interview and hire the musicians, and they have to bring their instruments and get their instruments tuned up, and then you have to give them the music or the score, which again has to be written by a composer, and they have to practice, and you have to have a good conductor, and only after significant time and investment does everything start working together and start to sound beautiful, right? There's a lot of different steps that have to be done well for the full power and life of the music to be manifested. And it's similar, taking care of patients and recovering from tick-borne disease is kind of similar. You have to get everything tuned up, get everything working together, get everything functioning as it used to, kind of on its own, quote unquote, normally. And only then, once all those pieces are addressed, does recovery really happen. So again, functional medicine really thinks along these lines, and we're working across all these different compartments to try to restore optimal functioning and balance. And we're talking tonight a lot about the stealth infections, the tick-borne diseases, the immune imbalances, but we'll also dive into some key areas a little bit, gut health, diet, nutrition, hormone imbalances, mold, brain and emotional healing, inflammation, etc. All of these factors are really essential. So in our work, we always focus on the gut, and the gut is really the center of the universe when it comes to your immune system. And so it puts us in a little bind sometimes, because we do know that antibiotics can be really helpful for a lot of patients, but they also can have risks, right? So it really does help to focus pretty deeply on targeted nutritional interventions, working with the individual and making sure that we're optimizing what their body needs. But this can really help to support the immune system, to decrease inflammation, to decrease autoimmune activation, and really help your body recover, which is, it helps other Lyme treatments to work better then. Gut health overall, in addition to the nutrition approach, is crucial for recovering from Lyme disease. And the Lyme and co-infections, all these bacteria, especially Lyme and Bartonella, in particular, can really trigger a lot of pathology in the gut. And this can cause inflammation, again, immune dysregulation, autoimmune activation. These bacteria have been isolated on colonoscopy biopsies, in the gut tissue. And so really, it's kind of chicken or the egg on how we address this. But as many of you know, this is a favorite topic of mine that I always like to dive deep into. Because again, when you do this, or I should say, if you don't do this, we definitely have seen less optimal response to treatment, and also when people do get better, an increased risk of relapse. And so it's a really key part of treatment for Lyme and all illnesses, really. And the flip side is true as well. You know, if we leverage the gut healing and we're really careful about the work that we do see people recovering more quickly and more robustly and responding in a more linear fashion to the treatments that we're using. Neuroplasticity and emotional healing is a really key area that we've focused a lot more on in the last couple of years. And there's a lot of different aspects to this. You know, we know that people living with complex chronic illnesses live in an internal state of limbic system activation. Their amygdala, their hypothalamus, hippocampus, they're all in this sort of fight, flight, freeze state because, in effect, like Lia said in her symptom journals, you feel like you're being attacked, and you are being attacked, right? There's these bugs that are in your body that shouldn't be, and they're causing all this havoc. And so your body and your brain is, just constantly trying to process that and figure out what to do about it. In addition to direct treatment of Lyme and the bacteria and the body, we do find that coming at it from the brain side and working on emotional healing and brain retraining is a really key part of recovery. Again, just working to calm down the amygdala, calm down the fight flight state and allow the body and brain to reset. And I'm always very careful when I talk to people about this because people unfortunately have the experience, having the illness is traumatic, and going to all these doctors and being told it's all in your head is traumatic, and being told you should see the psychiatrist and be on an antidepressant is traumatic. And so I'm always really careful when I bring this up with folks that I'm not saying it's all in your head. I'm not saying I don't believe you. I'm not saying I don't think you have Lyme or co-infections that we need to address. But at the same time, if we do all these things together, in that symphony analogy, everything works better. So they're all important parts of the puzzle. We also see a lot of hormone imbalance and dysregulation, especially adrenal, thyroid, sex hormones, and rebalancing the hormones can be a really intricate process, but really significantly help a lot of the symptoms, especially mood, energy, sleep, immune system function, and recovery. Mold exposure is also very, very important. Mold can really dysregulate the immune system and cause a ton of inflammation. And, as we've learned with the COVID-19 pandemic this last year, there's multiple things that are going on. There might be a virus or a bacteria that's causing an infection. However, there's also this whole secondary process with regards to the immune system and inflammation. And that is, needs to be addressed sometimes in a separate way in order to help people recover. And mold toxicity can really mimic or exacerbate a lot of the symptoms that we see with Lyme and co-infections. So really, again, is an important part of the healing journey. In terms of antimicrobials, conventional medicine really frequently relies solely on pharmaceutical antibiotics, antimicrobials that are prescription-based to treat Lyme disease. And obviously, there's a big divide there in, how long that course should be. The mainstream IDSA, CDC point of view is that should be pretty short and is usually pretty effective. And doctors like myself and doctors who treat this in a more nuanced way, we definitely see that those treatments do frequently need to be longer term and more nuanced and more layered. But it's also important to understand that in addition to the prescription antibiotics, there are a lot of other options. There's a lot of herbs, other natural antimicrobials, which can be really helpful and effective and can give deeper healing in some cases while causing less damage to the gut. So a lot of important reasons to consider these, and they're, again, just part of the toolkit. These are just different options that we have to use at different times. And as many of my patients have experienced, we do a lot of rotation. A lot of doctors that are doing the work that we do are in the same boat. We're just always trying to keep things moving, keep the bugs on the run, and affect a lot of different change across the body. So I want to spend a little bit of time talking about some of this really exciting research that we've been conducting, funded in large part by the Bay Area Lyme Foundation. Thank you again. And this work, we've had 2 studies that have been published and one that's hot on the presses, and hopefully that'll come out in the next couple of weeks. Done in collaboration with Dr. Ying Zhang when he was at Johns Hopkins, as well as his team there, and also my friend and colleague, Dr. Jacob Leone. And we've been, over the past couple of years, we've been taking herbal medicines and natural products and using the laboratory model developed by Dr. Zhang and testing these against the Lyme spirochete bacteria and as well as Babesia and Bartonella. And the medicines that we chose, the botanical medicines, were ones which are already pretty commonly used in the Lyme and tick-borne disease doctor and patient communities. And so it made sense to look at what are these showing us in the lab setting. So again, we focused on Borrelia, the Lyme spirochete, as well as the co-infections Babesia and Bartonella. Our first study published last year investigated the antimicrobial effects of 12 commonly used botanical medicines and several other natural antimicrobial agents. And they were chosen again based on preclinical data from the literature, the fact that they had favorable safety profiles, could be absorbed systemically or from an oral administration, taking it by mouth. Again, we've had a lot of, they were picked based on ones that we were using in our practices, as well as other ones that we've heard a lot of anecdotal use from both patients and providers. And I want to just kind of point out, it's really important to understand that this was a test tube study, right? So it's not in humans, not in animals. And so we'll talk a little bit more about that. There's, in terms of it affects sort of what can we take away from this and what can we not. Doesn't take away from the fact that this is just really important, research that needs to be done. But there are some things to think about in terms of how we then put this into use. So basically what we did in short was, to take this laboratory model of the spirochete bacteria in a test tube and to add these different herbal medicines at different dilutions and to see how well they would kill the spirochete Borrelia bacteria. And in addition to putting them into that test tube and then checking to see how many, spirochetes died, Dr. Zhang and his team also tested to see which treatments would then also prevent the Borrelia bacteria from regrowing from a subculture up to 20 days later. So we know that killing the Lyme bacteria is one part of the puzzle, and we know that then also preventing it from coming back, because it's a pretty wily critter that can pull a bunch of different tricks, to persist and to evade or hang out or just hunker down and wait out until the killer agent is gone and then come back. So subculturing and seeing what was going to regrow was really, really interesting. So this first study found that there were 7 key botanicals that were active against the Lyme bacteria in the test tube, and these included Cryptolepis sanguinolenta, which is right here, Polygonum cuspidatum, also known as Japanese knotweed, Artemisia annua, sweet wormwood, very common herb and a lot of anti-parasite formulas, as well as a strong anti-malarial agent, Scutellaria bicalensis, or Chinese skullcap, Juglans nigra, black walnut, Uncaria tomentosa, Cistus incanis, and also Alcornia. This was not part of the first study, but was part of some of the subsequent studies. So we're going to meet each of these plants tonight and learn which organisms they were active against in the 3 different studies. It's just a visual showing some of the results. You can see here, basically this is the cyber green technology, which shows the either live cells or dead cells. So either black or black indicates no cells at all, red indicates there are some dead cells there, and then green indicates live cells still remaining, right? And so we can see here at the top, Cryptolepis did a great job, black walnut as well, Japanese knotweed at this dilution did pretty well, but at this lower dilutions, we're starting to see some live cells creeping in. And then you can calculate bacterial viability by calculating the ratio of the green to red fluorescence to figure out how these products did. Really, really well received. We were really excited and honored how needed this research seems to be. This is in Frontiers in Medicine. There's been over 45,000 views of this article, ranking 99% of all Frontiers articles ever published in this journal. So again, huge thanks to the Bay Area Lyme Foundation for being on the cutting edge of supporting and funding research that is timely and critical. The second study that was published just a couple months ago looked at a similar panel of herbal medicines for the treatment of babesiosis, or Babesia duncani. And this study found that Cryptolepis, Artemisia, Scutellaria, Alcornia, and Polygonum cuspidatum had good in vitro inhibitory activity against Babesia in a hamster red blood cell model. And they also found that there were certain extracts from these plants that were bioactive, and that included things like cryptolepine, artemisinin, artesunate, and bicolin, which are extracts of the different plants. Of course, this is an interesting avenue because this kind of research can potentially eventually lead to new pharmaceutical medicines, which is kind of the holy grail, not just for Lyme, but for antibiotic development in general. And then the most recent study that we're still in the final stages of publishing found that 5 of these extracts, particularly Cryptolepis, juglans, Polygonum, Scutellaria, 2 different forms of Scutellaria, had high activity against Bartonella henselae. So I want to just kind of go through a little bit about each of these plants for your brains. Cryptolepis has been shown to have anti-inflammatory, antimicrobial, and anti-amoebic activity, as well as anti-malarial properties. And all 3 studies found this plant to be effective against Lyme, Babesia, and Bartonella. This is a really exciting and groundbreaking finding. Crypto in general is very well tolerated, not very many side effects. It's been used long-term in China and India. And given its traditional use against malaria, it's been a common botanical medicine in the Lyme community that was picked up and started to be used, sort of crowdsourced, and then we ran with it and are seeing benefit against babesiosis, Babesia, because of the fact that Babesia is a malaria-like organism. And crypto in general is a really powerful antibacterial, general antibacterial herb. And so we put it into these studies because we were hoping that we would find out what we did, which it does look like in the test tube, it's active against these other pathogens as well. And our research is some of the first actually to show activity against both Borrelia and Bartonella. Again, there is historical evidence against malaria, which we were translating to Babesia, but particularly for Borrelia and Bartonella, that was really new. Obviously, we need more research in animals and humans to follow this up, but some exciting preliminary findings. In addition, Cryptolepis and the Polygonum, the Japanese knotweed, showed really a strong ability to prevent those subcultures, those 20-day subcultures, from growing back with the Borrelia organism in the Borrelia study. So really fascinating results and fascinating plants. Previous studies have shown Cryptolepis to have anti-inflammatory, antimicrobial, anti-amoebic, anti-cancer, anti-malaria properties, as I mentioned. Japanese knotweed, or Polygonum cuspidatum, also showed good inhibitory effect against all 3 organisms in the different studies. And the polyphenol resveratrol in Polygonum cuspidatum is one of the main active constituents, and there's just a ton of research on resveratrol. It's a really powerful molecule compound, and we've previously studies have shown some activity against different forms of Borrelia, including Borrelia burgdorferi as well as Borrelia gaertneri, against the growing forms of them, but not so much against the round bodies or against the Borrelia that are in biofilms. Japanese knotweed, or Polygonum, has been found in general to have pretty minimal toxicity in human and animal studies. And there's limited evidence using it as the whole herb. It's usually used as more of an extract. But the whole herb does contain 60 active constituents at least, with varying degrees of bioavailability and mechanisms of action. And with resveratrol in particular, it's been studied and shown beneficial in cardiovascular disease, certain types of cancers, inflammation, high blood pressure, triglycerides, high cholesterol in general, metabolic syndrome, and more. Side effects are possible. You can get some gastrointestinal upset that's usually pretty mild and dose limited, usually stops pretty quickly when the treatment is discontinued. So again, pretty fascinating plant, one that we were excited to study. Minimal toxicity, as I mentioned, and the GI side effects are some of the main ones, but in general, reviews have shown, again, pretty well absorbed orally and rapidly metabolized, so pretty high functional. So the first two studies, studies 1 and 2, found Artemisia to be active against both Lyme and Babesia. And the Artemisia was shown to have excellent activity against that stationary phase or subculture as well. So Artemisia annua is a Chinese herb, also known as sweet wormwood, and it's been used for treatment of malaria for centuries. And in fact, the Chinese scientists who isolated its most famous active constituent called artemisinin was awarded the Nobel Prize in 2015 for recognition of Artemisia's or artemisinin's role in reducing malaria-associated morbidity and mortality. And so artemisinin-based compounds are actually really pivotal at this point globally for the treatment of malaria, and they can reduce the parasitemia actually more rapidly than many other known anti-malarial drugs. And these compounds are also effective against all stages of the Plasmodium or malaria species bacteria. Past studies have shown Artemisia to have some good activity against Borrelia burgdorferi, and our findings in the second study build on this and also show the benefit potentially against Babesia, which was really exciting. It can be used at pretty high dose, a couple thousand milligrams daily for up to 10 weeks or longer. Side effects can include some GI upset, mild nausea, rarely some vomiting, some abdominal pain if you really push the doses up. And the use of whole plant extracts really can have some potential benefits over single constituents because we provide, in those extracts, it's just more complex. There's multiple different mechanisms of action, synergistic effects that can reduce the risk of developing microbial resistance. Importantly, thing to note about Artemisia, it can actually induce its own metabolism. So if you just kind of take it straight through every single day, week after week, it'll actually, decrease its own blood levels by inducing the metabolism. So we generally pulse Artemisia, either 4 days on, 3 days off, or 1 week on, 1 week off, etc. Scutellaria bicalensis was found to be effective in the first and second study against Lyme and Babesia. And this is a medicinal plant that's been used in China for thousands of years for a lot of different conditions, including diarrhea, dysentery, high blood pressure, hemorrhage, insomnia, inflammation, respiratory disorders, etc. And there are over 40 different compounds that have been isolated from Scutellaria bicalensis, and the antimicrobial activity is hypothesized to be due to a variety of these compounds, including flavonoids, volatile oils, terpenoids, polysaccharides, etc. And bicalin, which is one of the extracts from Scutellaria, has been found in research to be one of the primary bioactive constituents. And it actually has in the past been shown to have activity against both Borrelia burgdorferi and Borrelia guarinii. So the finding against of Babesia was a new addition and pretty exciting. Scutellaria and its constituents have also been shown to be neuroprotective, antioxidant, anti-apoptotic, anti-inflammatory, and have anti-excitotoxicity activity, sort of overstimulation, brain inflammation, etc. Interestingly, Scutellaria has also been in a very important medicine in helping for the prevention and treatment of COVID-19. So it's really been discussed a lot in circles this past year. So the first and third study, the Borrelia study and the Bartonella study, which is still in press, found juglans or black walnut to have activity against both Borrelia and Bartonella. And the constituents of juglans have been shown to have antioxidant, antibacterial, anti-tumor, and chemoprotective effects. And previous in vitro testing has shown, again, some activity against Borrelias, but the Bartonella finding was a new addition to the literature. Pretty well tolerated, pretty safe herb. The most well-studied active constituent is EGCG, which also can come from green tea. And this has been documented to have significant benefits for multiple different conditions, including high lipids, metabolic syndrome, acne, breast cancer, upper respiratory tract infections, just to name a few. It can cause some GI upset and also can induce changes in skin pigmentation. So it's one thing to look out for. And if you're allergic to walnuts or to nuts, you do want to be a little careful. There can be some allergic cross-reactivity in those who are allergic to tree nuts or walnuts, and also some cases of dermatitis, skin irritation. Uncaria tomentosa, also known as cat's claw, pretty well regarded herb in the field, and a lot of people have used this for Lyme disease historically. South American plant that we saw a lot of when we were in Ecuador and South America, and very, very commonly used by the variety of different curanderos. And it's active against Borrelia in our first study. It's been documented to have neuroprotective effects, and in preliminary human studies, it's shown the ability to help in certain cancer cases, help with DNA repair, and then symptom improvement in inflammatory conditions such as osteoarthritis and even rheumatoid arthritis. So some nice anti-inflammatory effects. I do wonder when it's seeing benefit against these rheumatological conditions, if it's also treating some of the bugs that might be in the background triggering infections. There's a great new book out called Chronic by Dr. Stephen Phillips and Dana Parrish, and they dive deep on the likelihood, we would say, the likelihood that many chronic conditions and chronic autoimmune conditions are in fact triggered by microbes underlying that haven't been resolved. They're still persisting and causing inflammation. So I think that's also one of the reasons why medicines like Plaquenil tend to work well in rheumatological conditions, because it works as an anti-inflammatory as well as an antibiotic. Cistus incinus is another plant that was found to be active, and this one you'll see, a lot of these are not native to our areas here in California, but cistus is one that you'll see around. And when I go out and walk in our neighborhood, I'll see this plant, also called rock rose, growing. So it's kind of cool just to see it there and say hello. Cistus has many different active constituents, including carvacrol. And there is some previous research on carvacrol showing activity against log and stationary phase. So log is like the growing phase of the bacteria, and then stationary is more the persistent or dormant phase of the bacteria. And previously, again, also showing benefits for upper respiratory tract infections, inflammatory markers, et cetera. And there's evidence that the volatile oil extract, again, can have some anti-Borrelia effects. So we were just excited to build on that research and to show some benefit in this laboratory model. Cistus is pretty safe. It's been used for centuries in traditional medicine without much report of side effects or allergic reactions. We should also mention this plant, Alcornia cordifolia, was in the second study was shown to have good inhibitory benefit effect against Babesia, and it's also been documented to have antimicrobial and anti-inflammatory activity. So I'm going to move towards wrapping up. We'll have some time for questions. It's been, again, a huge honor and a pleasure to be able to conduct research on botanical medicines with this rockstar team of scientists and researchers and contribute what we could. Again, we studied the Lyme spirochete, Borrelia burgdorferi, as well as the co-infections, Babesia and Bartonella. And, since the traditional antibiotics, are imperfect, they work in some cases, but in some cases they don't resolve all the symptoms. As you heard from Leah's story, we did some heavy hitters, and it was really just going into a deeper clean out phase that finally got her really on the path to recovery. So again, we need more treatments. We need more understanding of options and more antimicrobial agents that are active against these bacteria. And given the frequency of co-infection that we see with Lyme and tick-borne disease patients with a lot of these different bacteria, including Bartonella and Babesia, Ehrlichia, et cetera, this overlapping activity that we're seeing with some of these plants was really exciting. Cryptolepis and Polygonum against all three bugs, Juglands against Lyme and Bartonella, Artemisia against Lyme and Babesia. Really exciting early phase, obviously, in the test tube, but early phase findings, which can potentially point towards additional potential therapeutic agents for hopefully improving treatment outcomes with our patients and with you guys. Herbal medicines in general are really powerful and really beneficial in a lot of cases. Important part of the tick-borne infection protocols, as well as the broader antimicrobial protocols. And if you want to learn more about these herbs, a lot of you probably know these books, but I'll just show them to you. This is Stephen Buhner's classic called Healing Lyme. If you go out and get it, definitely get the second edition. Really amazing book. The first section is a little bit terrifying, I'll warn you. So you might want, if you're feeling a little stressed or PTSD about the condition, skip over that first section. But it's really like this is a reference manual. I refer to this book constantly, just looking up different options, different protocols, different dosing regimens. Obviously, I didn't go into any detail. I can't really advise on how to treat individuals in this forum, but a lot of really detailed information on that book, as well as on his website. He also has this herbal antibiotic book, which is amazing and great for all sorts of different conditions, and obviously very timely herbal antiviral book. So all three of these are worth having on your shelf or your Kindle, so you can access them and have more options available to you. So again, before we close, I also want to point out that, just to reiterate that all these studies were done in the lab, right? And so we call that in vitro. And it's important to look at and talk about the limitations of that, right? Because this is outside of the biological organism. And the in vitro model really can provide us evidence or information on the direct antimicrobial activity of a compound, but it doesn't really, this is only part of how herbs and botanical medicines work, right? It might be the main part of how an antibiotic works, but for these really complex plants that have all these different compounds, it's only part of the story, right? These botanical medicines also work along anti-inflammatory, anti-cytokine activity pathways, immune system regulation and augmentation, adaptogenic stimulation of the cells, organismal defense systems, biofilm disruption, et cetera. That's why when we've talked about each slide of some of the basic properties or functions of these herbs, you see all these different ways that they're exerting their mechanism of action. So we in the in vitro or in the test tube model, we lose all that. We don't get a sense of what's really happening there. So it's just part of the story. It's a good place to start, because all those things are really happening within the interplay of the entire organism, right? So but again, so what does that mean? It basically means that there's more work to be done, and there's a lot more research that needs to be done. And the exciting thing about using these herbs and botanical medicines to study was that, well, these are already being used by a lot of patients, and they're being used in traditional herbal medicine and Chinese herbal medicine. And so there's a lot of research out there showing safety and efficacy and how they're working, et cetera. So it feels, in my opinion, safe to use them in these applications, even though the research that we're developing on the tick-borne side is newer. Obviously, I would want you to work with a knowledgeable provider, when we're mixing and matching things that requires some support. But again, there's a lot of availability of some of that information in book form and on the internet. So yes, this is a picture I took on the ridge on Mount Tam overlooking Stinson and Bolinas. Super beautiful springtime in California. I grew up here. It's one of my favorite places in the world, and spring is one of my favorite times of year. And there is Lyme here in California, and some of the chat questions that we were seeing, like the pictures of what that Lia posted of us, burying ourselves in the leaves. Yeah, maybe don't do that, right? I'm not going to be doing that anymore. But we still go out and hike. We still enjoy nature. There's lots of different ways that you can protect yourself, and awareness is the key, right? So look on the Bay Area Lyme website, look on our clinic website. Both websites have really great information on how to prevent tick bites, what to do if you get a tick bite. We really walk you through a lot of information that you need to know. So get out there, enjoy nature. Just be careful, be aware there's ticks here in California year round, and make sure you do really careful tick checks. Thank you so much, and I will pause my screen share, and we're happy to stick around for the next 25 minutes or so if you guys have questions.
Can I ask a question? This is Mary. I'm your patient.
Yeah, Mary.
I want to know about the herbs and bioavailability or absorbability in the human body. I understand that the tests were all in vitro, not in vivo, and I'm just looking to understand, what is known about how the body best absorbs these in case they are useful in vivo.
Yeah. So, and I'm getting a little. Let me put this over here. So yeah, great question. And again, the natural products that we presented tonight are all generally very well absorbed orally. And so from that point of view, these are all available. Most of these products that I mentioned, we will use in tincture form. And many of them are available. Some of them actually, not many, like for example, Japanese knotweed and cat's claw, Uncaria are available in capsule form as well. So there's a lot of different either pills or liquids. And again, quite well absorbed orally. And Stephen Buhner's book, this one in particular, does go into a lot of the intricacies of that, as well as the herbal antibiotic book. Those are all really good resources.
Can I ask next?
Cindy, I see your hand up.
Oh.
Yeah, can you hear me?
One second, let me play with my volume here.
Can you hear me?
Okay, go ahead.
Do you know, is there any reference of Bartonella being a cause of retinal problems?
Yeah, so Bartonella and Lyme can both cause a lot of ocular issues. And there's actually a lecture yesterday by Dr. Stephen Padilla that was sponsored by iLads, which is going to be recorded. So look on iLads' website. That might be an interesting talk to listen to. He's an ophthalmologist on the East Coast. He focuses on tick-borne infections.
He does. Okay, that's great. Thank you.
Yeah, you're welcome. Steve.
Thank you. My original question was, you showed a 60% for that in vitro testing. How would that compare to a normal to heavy dose when we're taking those same herbs? As I know it's completely different, but how would we be able to compare the two and use that? Yeah, so
because the percents that we use, and you'll see those in the studies, if you pull up the articles, you can look at the different percent dilutions that we use. We also tested the alcohol extracts by themselves to see if alcohol was in fact what was killing the bacteria, and it wasn't. So there were the active compounds in the herbs themselves that were active. But you're not going to be able to translate the percents there into any sense of what do you need to take to get that level of a dose. So again, referring to Stephen Buhner or any other Western herbal literature, they do a pretty good job. Like Stephen's book, he's very specific. He gives you really good doses. And there's usually a pretty wide range, right? So it's sort of like, are you trying to just tune yourself up and do more of a tonic treatment? Or are you being more aggressive? Is this an acute infection that you need to treat much more aggressively? So you might see something, like quarter teaspoon 3 times a day up to full teaspoon even 6 times a day, right? So it's kind of that level of like a dose range that they'll frequently provide. I'm not, again, comfortable providing exact treatment recommendations in this setting, but again, those are available in Stephen Buhner's books, as well as a lot of different websites. So I would encourage you to look that up.
Great, thank you.
Yeah, Jamie. Hi, Jamie.
Hi, Dr. Schweig. How are you?
I'm well,
Great
thanks. Thanks for
presentation.
coming. Thank you.
My daughter actually has a question.
Oh,
She
cool.
was wondering, she's being shy, doesn't want to show her face at the moment, but she's sitting right next to me. And she's wondering, she knows that you covered 3 of the co-infections. There she is. And she's wondering how many co-infections exist with the tick-borne infections, because she knows that she's diagnosed with all 3 of the ones that you talked about, but curious about others.
And what's your daughter's name? Remind me.
Jordan.
Hi,
Can you say
Jordan.
hi?
Nice
Hi.
to see you. Thanks so much for watching, and thanks for your interest, and thanks for your great question. Yeah, so there are a lot of different bacteria and viruses that the ticks can carry. The ones we talked about tonight are some of the most common, right? Ehrlichia I mentioned. The ticks can also carry different forms probably of mycoplasma and chlamydia and viruses even, Powassan virus, bourbon virus, different kinds of rickettsia species. So there's a lot of in there, because what happens is that ticks feed on a lot of different animals as they kind of pick up different things from different animals. On our website, we list, and on Bay Area Lyme they do as well. Also, I really like the Columbia University Lyme Center. They have a really nice list of a lot of the bugs that are in ticks. Yeah. Great question, Jordan.
Thank you.
You're welcome. Thanks for being here.
Yep.
Yeah, Irina, welcome.
Hi, thank you so much. I had actually 2 questions because I have some deer in my yard. Is there, first of all, are there any herbs that in the event I find a tick on me, or Ashar finds a tick on her, if one of us finds a tick on us, are there any herbs that are good to take right away in that event? And then also, anything we can do about like deer going into our yard and whether that actually increases the risk? Ashar does a lot of gardening. So.
Yeah, and I know where you guys are. There is definitely Lyme in that area. So yeah, deer carry a lot of ticks. We euphemistically call them tick buses, passing along their routes. And yeah, I mean, fencing is really the best way if you really want to be, fully protected or better protected. I won't say fully protected because there's a lot of different species that carry ticks as well, including the mice and the possums and raccoons and
squirrels. California, it's the California gray squirrel. That's our biggest problem. The deer are not our biggest problem over here.
And birds too.
Mm-hmm.
So yeah, what do you do to be safe? There's a variety of ways, and Bay Area Lyme has some nice information on this on our website of how you can sculpt your landscape to try to decrease some of the risk. It's certainly not perfect, but it helps. You can also put cotton soaked with permethrin or other anti-tick insecticides inside of like toilet paper rolls for the mice to pick up or rub through and coat their fur with that.
You can buy those online. They're called tick tubes. You don't have to deal with the permethrin yourself. But there is information online about how to protect yourselves. And I know people on the East Coast, even there are services that will come and, yeah, I see a hand up, that will come and do natural or, full chemical tick abatement. But really, tick checks are the most important thing that you can possibly do, is just being aware. So the fact that you're all on this call means that you're all in much better shape than most people who don't even know that they need to be aware and do tick checks.
Yeah, great points.
Can they, like if they get on your clothes, and you hang up your clothes just like somewhere before you put them in the wash, can they actually like go and get on you later, or get in the house?
Yeah.
Kind of house, or is they pretty much like once they're on your clothes, and if they're like in a dry environment, they'll die? Like
I was trying
let's
not.
say they're like,
I was trying not to make this a full normal talk that I do about Lyme and tick bite prevention, but I'm happy to do it. But I'm sorry I left all of this out of the story, that you guys still have these more basic questions. But yeah, you can protect yourself in a variety of ways. You can wear natural or permethrin or DEET, oil of lemon eucalyptus kind of repellents when you go out. You can also buy pre-treated clothes. If you want to do totally, the more natural oil of lemon eucalyptus would be the choice. I see some head shaking. That's my personal choice. And I think that it's really important to know that as soon as you come in, you take your clothes off. If you have a dryer, you put them in the dryer on high for 20 minutes because the ticks desiccate in the heat. And so if you put it in the washer, they won't die. They can stay underwater, I think, for 70 days or something. So you want to put them directly into the dryer, even if your clothes are kind of dirty, unless they have poison oak, in which case don't put them in the dryer. But you want to put your clothes in the dryer. I have a colleague at the Bay Area Lyme Foundation. Her kids went on a hike and came back, and she put their clothes in the dryer. She found 14 ticks in the lint trap, 14 dead ticks. So, and then get in the shower and do a thorough tick check and try to wash off any ticks that might be crawling up. They tend to crawl up. And so, by the time you've gotten in the shower, they might have already crawled, from the ground, from your boots, up. And to be honest, ticks, we think of ticks probably the kind that you can see crawling around on your dog or your couch or your car. They can come into your car from your dog. So maybe you've seen them that way. But the ones, especially in California, that we worry about the most are actually the nymphs that are the size of a poppy seed. Not to make you all totally paranoid, but when we go camping in high endemic areas like, Mendocino County, Northern California has rates of infection. The ticks are infected almost at the rates of the East Coast. So we will tick check our kids when we're camping and tick check ourselves with a magnifier and a headlamp. That's how hardcore we are. And that's how I found that little tick that I featured in the beginning of my presentation. So I don't want people to be paranoid, but really just knowing about it will make you so much safer. And you can also wear light colored clothing so that you can see the ticks crawling on you. And you can tuck your pants into your socks, and you can wear permethrin coated, shoes on the outside. Don't ever put permethrin on your skin. You can wear a hat to protect yourself. Ticks don't jump, but they can fall. And always remember to check all over. Check your hairline, your scalp, behind the knees, the groin, the belly button. I can't tell you how many kids have picked ticks out of their belly buttons. And ears, this seems like the dermacenter dog ticks really like ears. So it's just, enjoy nature, go out there, do it all, camp, hike, but maybe stay away from the edges of the trails where the grasses kind of overhang, because the ticks like to quest and look for a blood meal by hanging out right at the tips of the grasses. I've gotten so good, I can just see them when we're hiking, and people can't believe that, there's ticks on almost every stalk of grass, sometimes on a trail, depending on the season and the location. But you want to try to stay in the center of the trail, not in the tall grasses, not in the leaf litter. They can sometimes be on logs. So you just got to maybe stop every half an hour and do a thorough tick check, make it fun for your kids, do a little tick check dance. There's a new video out that's on TikTok. That's like a tick check video song. Try to make it fun. It's just part of life. It's just one of the safety things that we have to think about as humans who have co-evolved with these really, really smart and very evolved ancient creatures who carry even more ancient pathogens like Lyme Borrelia bacteria. And check your pets. Somebody says, check your pets. Absolutely. And there are, things you can do to try to mitigate your pets bringing in ticks. Our poor dog only gets to walk on city sidewalks because he doesn't get to run in the wilds of the hills and the grasses. But people certainly use, collars with repellent and oral medicines and things like that. But a tick check is always best.
One of the newer compounds that I'm interested in and is being used more widely is called nucatone. And you can actually get nucatone. It's a natural derivative from a cypress tree. You can get that as a soap, and you can use that in the shower after you might have had a tick exposure. It actually does a really impressive job about getting the ticks off your body.
I think it just got FDA approved.
Claire, you had a question.
Yeah, actually, it's more of a thing. I'm zooming in from Maine, but where I've lived for the past 13 years, I'm a nurse practitioner, but I lived in the Bay Area for 23 years. And since I moved to Maine, I have had Lyme myself 3 times. I use Stephen Buhner's protocol quite a bit. And by chance, I live in the state with the highest per capita rate of Lyme and tick-borne disease in the country. And the county I live in has the highest rate in the state of Maine. So I deal with this a lot. And just a few tips. There is a non-toxic spray based on with essential oils called Tick Kills. You go to tickkills.com and you spray that in your lawn after you cut the lawn short, and it really works and it stays in there for a long time. As far as pets, there's something called Effitix, EFFITIX. They make it for dogs and for cats, and it works quite well, especially in combination with some effective collars. I have a dog that roams around several acres, and when we keep up with the topical and the collar, he can tear through the woods and not bring ticks home. So there are effective non-toxic methods to keep up with this. There is a spray called Ticks and All, TICKZNALL, something like that, out of Florida. That is actually quite effective, and they have done studies to show how effective it is and how the ticks walk away from anything that has that on it. And I have a protocol on my website I put in the chat for measures you can take when you get a tick bite. The information is somewhat specific to Maine because we have the ability to send a tick into a lab and they'll identify 3 possible infections in a tick lab. But
thank you, Claire, for bringing that up. I want to cover that. That's a really good point.
Yeah.
So if you get a tick, what we do in our house, and there's no authority really telling anyone what to do. The CDC, I think, still says flush it down the toilet, which is absolutely not what we recommend. But what we do is we save it and we identify it to the best of our ability on the Tick Encounter website, which is University of Rhode Island. And then for us, it's really either a dermacenter tick, which is a dog tick, or it's an Ixodes tick, which is a Western black-legged tick out here in California. We know that the Western black-legged tick carries Lyme and Babesia and other diseases, and the dermacenter tick can carry Rocky Mountain spotted fever and things like that. So once we've kind of identified, male, female, usually ticks are female because they're the ones that are trying to feed and take a blood meal. But one of my colleagues just had an engorged male on her here in the Bay Area. So we try to kind of figure out what it is, and then we put it in a Ziploc bag with a moist paper towel, and we send it for testing overnight, usually, especially if it's been attached, for at any length of time, really. It's probably on the East Coast, there's Powassan virus, which can be transmitted in 15 minutes, but that causes an acute disease. But we definitely try to get them tested and identified at places. The University of Massachusetts at Amherst has a place called Tick Report, and they give you an email within 3 days telling you what kind of tick it was, how much it had fed, how engorged it is, and which pathogens it can be carrying. And you can decide whether you want to test for 7 pathogens or 20 pathogens, and the cost differs. And that doesn't mean that if it's a clean tick, it doesn't mean that you didn't get another tick bite somewhere. So if you have symptoms, you still need to pay attention to your symptoms, right? Just because you have a clean tick doesn't mean that you can ignore anything. You still have to be careful. But if it's positive for something, I think that warrants, getting in touch with a medical practitioner right away if you're not already in touch with a medical practitioner after a tick bite, which you probably should do anyway. But we really encourage people to save their ticks and send them for testing. And when you take out a tick, just Lyme and tick basics, use pointy tweezers and get as close to your skin and the head of the tick as possible. Try not to squish the tick with the tweezers or your fingers, because then it can regurgitate its stomach contents into you. And so you want to avoid that. You want to just gently remove it as close to the skin as possible and pull straight back and then save it. And don't use a match or Vaseline or nail polish or twisting or any of those things. Just pointy nose tweezers.
Yeah, again, Area Lyme has a nice document here for print or download, what to do about a tick bite. Super helpful.
And we're being asked if ticks need to be in for 24 hours. That is, I think, what the CDC is still saying, but there's not a lot of solid evidence for that. And we've certainly seen many case studies and case reports of people getting diseases in a much shorter amount of time. So we don't believe that there's like a safe time. So
Or is it?
Yeah.
Michelle. Nice to see you. Thanks for coming.
Good to see you. You had mentioned when you were talking about gut health, about, chance, like tending to your gut health can help prevent relapse. And can you just talk a little bit about relapse? Like for those of us who have Lyme disease and any co-infections, is there really is there any way to, have it go away for good, or is it always a continual, or is it, have you only seen, is it always a continual amount of management, even after no symptoms? Are you always concerned about a relapse?
Yeah, no, it's absolutely possible for people to get better and to not need ongoing treatment. It can be a long process. It can be an elusive process. But in my view, you have to just be as persistent as these bugs are themselves. So thinking about, and putting the intention out there for full recovery and, living a healthy life. There's, after we've treated people in our practice, there's certain checkpoints that I think of. And, roughly the first one I think is 3 to 4 months. If people get past that point and they're still doing pretty well, I'm feeling good. But really, 6 to 9 months is an even better one. And if you're still doing well and symptoms seem pretty steady, maybe you're on some maintenance treatment or some, I think some herbs just to kind of keep any residual bugs suppressed. Really what you want to do, the job is not just to kill everything. You can't kill your way to health. So you need to basically, take care of the bacteria, kill as many as you can, get the immune system really tuned up. And then the immune system does a job of keeping those bugs in a box, really. And I don't know, I'm not really convinced that you can, to your point, that you can eradicate all of the bacteria, but I don't think that you necessarily need to be healthy. Again, there's many, many different viruses that just live in us, on us, around us, that are there in our bodies, but don't cause problems because our immune systems and all of our body systems are functioning optimally. So that's the goal.
I think that's the piece that I think, at least myself, but I don't think it's like commonly known that we're living with viruses and bacteria all the time inside of us like that. I never really kind of thought of it that way.
Yeah, no, if you just look at the work in microbiome and microbiota, we are outnumbered by other bacteria, viruses, fungi, parasites by a factor of 10 to 1. So there's 10 times as many of them as there are cells in our body. And if you look at the genetic material that represents, it's probably actually like 100 to 1. So we use a lot of these bacteria to function optimally, and funguses and viruses, and they teach our body, they train our body, they help us metabolize vitamins and nutrients and gut, like vitamin K is dependent on gut bacteria. So it's just a matter of returning to equilibrium. Thanks.
So we're supposed to wrap up. It's 8 o'clock. Does anyone have one more burning
Looks like
question?
Lara has a question. Maybe the last one.
Hi there. Thank you so much. This has been really helpful. A lot of the information actually you just answered that I had, it was really time frame and how long like these herbals take. And I'm guessing it depends very much on each specific circumstance and how many co-infections you have and whatnot. I guess I was asking mostly because looking down the road for pregnancy, I was curious for when that would be feasible. And I don't even know if that's something you can answer. It might be a case by case, but it sounds like with the checkpoints you just discussed, that might be the best way to gauge how treatment is going.
Yeah, pregnancy is another area extra complex just because you have to be super careful about everything that you're taking. And many of the herbs are, some of them are probably safe, but many of them we just don't have enough information on. And so we just get very, very conservative in terms of treating people with herbs and supplements during pregnancy. Ironically, sometimes if we're still worried about residual infections, that means that we lean back towards the antibiotics more, which, really don't love doing. When I went into integrative medicine, and I thought I'd be using less drugs, and I probably do use less drugs, but the ones we use a lot of. And so in cases where we're not sure, it might make sense to be on antibiotics to protect the baby. It's a really hard decision. It's not what anyone really signed up for when they were thinking about having kids, but it might be worth it. You really just need to work with a knowledgeable person who has experience working with women and with pregnancy.
So thank you all so much for joining the Bay Area Lyme Foundation Speaker Series. There's another one coming up soon. You can check out our website. That will have Suruchi Chandra, Dr. Suruchi Chandra, who is, I think she's an adolescent psychiatrist, and another patient and advocate, Rena Lari. And there will be more speaker series coming up. Usually we do it quarterly. And please follow our announcements on our website if you want. I have a podcast and video series that I do called Tick-tective. My daughter's friend thought of that and did the logo. And our son is the editor and producer, and it's very professional. But that has some really interesting interviews. I interviewed, I haven't put it out yet, but Sunjya's co-founder at the California Center for Functional Medicine, Chris Kresser, recently, and I'm interviewing Tommy Hilfiger's daughter, who's wrote a book about Lyme, coming up soon. And I've also interviewed a lot of hardcore scientists at Harvard and different places like that. And some of those are really complex and highly scientific interviews, but I've also interviewed some other patients and patient advocates and Lyme, Lyme therapists and things like that. So there's just dig around on the Tick-tective podcasts on Apple or Google podcasts and or Spotify podcasts, or you can watch the videos on our website, bayarealyme.org. So thank you so much for joining us, and we hope that you all take care and learn something good, and we'll see you later.
Thanks, everyone. Have a good night.
Thank you.
Stay safe out there.